Welcome back. Johns Hopkins University has been on the front lines of the coronavirus, tracking cases across the country and now tracking the distribution of the new vaccines. And joining us this morning to talk more about their new process is the executive director of the Johns Hopkins Centers for Civic Impact. It's Beth Blauer. Thanks so much for your time this morning. Appreciate it.
Thanks for having me.
Let's just jump right into the numbers and tell me what you're seeing so far as you count these cases in the U.S. Any trends, anything that caught your eye?
Well, we definitely have seen exponential growth in cases over the last several weeks. We're going to, in the next day or so, hit the 19 million mark for the U.S. confirmed cases, which is, very much ahead of where we thought we would be at this point. We also are seeing a lot of people continue to die from the disease. So we're around 331,000 deaths, almost at 332,000 deaths today. If you think about it, in September, we were just at 200,000. So
Wow.
we've seen a very rapid rate of mortality with this disease, which has been really hard to watch,
Yeah.
affecting lots of Americans right now. And with these cases continuing to climb, we know that our hospitals are being stretched. So we're also tracking hospitalization data on the site at the CRC, the Coronavirus Resource Center here at Hopkins, where we're looking at the capacity of hospitals to meet the needs of the increased amount of patients that are coming through their doors.
And a lot of people, I'm sure the hospitals are too, counting on relief right now. And a lot of that hope is relying on a vaccine, something else you're keeping track of right now as far as distribution. How tough of a job is it to make sure that this vaccine is getting everywhere it needs to be? What are you finding as you track the distribution?
So we started tracking vaccines a couple weeks ago, and what we're tracking right now are the vaccines administered. So the Pfizer and the Moderna vaccines, which are the ones that have received the emergency use authorization, are now starting to find their way out into the states. And what the states are doing is that they're all reporting sort of different things. What we're tracking are the doses administered, but we know that it's going to get very complicated very quickly because both require a booster, so you have to get that second shot. So people are going to come in a couple of times. Plus, states are all sort of sharing the data differently. And so we know that some states will be breaking down the data by race and ethnicity, which we think is a really important way for us to be looking at the data to understand who's getting access to the vaccine. We know that some states are going to be tracking their total cash versus how many are administered. And so in the lack of any kind of standard, it's quite difficult for us to figure out what's the best way to render data on the website. And so we've right now stuck with cases administered, and we expect that that will change if there is some standard that is enumerated from the federal government.
Yeah, I guess that was my question. Had the federal government had in the past or in the future could consolidate some of this, I'm guessing tracking the data becomes even more accurate with one standard.
That's right. And what we've seen throughout the pandemic is actually a real lack of standard around how things should be reported. We started very early on realizing how difficult it was going to be to really contain the disease from a public health perspective and just to understand how it's unfolding in our communities with testing data. We didn't know who was getting tested. We didn't
Wow.
know who had access to getting tested. We didn't know which tests were in which data. And so we've spent the better part of the last 11 months trying to parse through data to understand, to get the American people and the global viewers of the site a real fundamental understanding of what it is that people are measuring when they talk about tests. And we're seeing the same kind of confusion with how the vaccines are being tracked.
Wow.
And with that kind of confusion comes all of the kind of openings for not trusting the process.
We have two holidays back to back. We just got through Christmas and now we're going to deal with New Year's. I'm guessing, do you suspect that you'll see a spike here as we deal with the next, I don't know, 30 days or so?
Yeah, I mean, it's just the worst time to have these big moments where we all want to be with family and we all want to be with friends, but the weather is cold, very cold. It's been really cold here regionally. People are forced indoors, which we know is increasing risk. When we're in the celebratory mood, we're less likely to abide by social distancing, by the compliance with mask wearing. And so we are seeing a rise in cases. We saw a rise in cases after the Thanksgiving holiday. And we're going to see the same thing from Christmas and New Year's, just given how many people have been traveling, the activity that we've seen in airports. We know that there's been some high risk behavior, and that's going to lead to, more cases and unfortunately more deaths.
Sure. Beth Blauer, heck of a task ahead of you, but we appreciate all the work you guys are doing over there at Hopkins. Thank you so much.
Thanks for having me.
Certainly.